Thank you everyone for joining us today. For those that don't know me, I'm Katherine Gold, CEO of GoldBug, an infant and toddler accessory brand, and excited to be here with Allyson Felix.
And I'm Allison. I'm an Olympian, and I'm also the founder of a company called Sage. In my most favorite title, I'm a mom.
Allison, I started to get a real taste and interest in maternal health during COVID when I read so many deplorable articles about the state of maternal mortality, et cetera. Then, Allison, you were a keynote speaker at the Women's Foundation here in Colorado, where I'm a board member. And I quickly became a groupie. I felt so aligned with you. So maybe you don't even know this, but I saw that you were then going to be a keynote in New York at an apparel conference, and I made sure to park myself as close to you as possible. In fact, I think I tackled you after that meeting in order to try and get your ear to collaborate. And you have. So this is wonderful. I wanted to take an opportunity to really discuss, though, the topic that's near and dear to both of us, which is maternal health. And I'll kick it off. As a renowned athlete and advocate and someone having her second child, what are your thoughts on the state of Black maternal health in America today?
Yeah,
You,
well, first I have to say that it was so good to meet you and just to connect on our shared passion around maternal health and inspired by all that you have built with your company as well. I think the state of Black maternal health in America is in a very difficult place. Um, I think about, finding out that I was pregnant and just not being able to experience the full joy in that. It's usually a moment that is so happy, and it was happy for me as well, but I also thought about the realities of what that meant. What that meant for my family and the risks, and although it was exciting, it was also really scary. And I think that is the state. I think that's how the experience is for so many women of color. We know the statistics and all that is happening here, and so I think it's in a really challenging place, and we have a lot of work that we need to do.
sure. I mean, you spoke out about both your experience with complications around your pregnancy, as well as the inequity you faced in your work with Nike at that time. The dual physical and mental stress must have taken a huge toll on you. Can you speak to the effect it had?
Yeah, it was a lot, going through both of those things at the same time, as fighting for maternal protections, fighting for female athletes not to receive a pay cut or a pause in their contract when they became pregnant, and to really be fully supported through their whole entire story. And that was really challenging. And then to then give birth to my daughter and have a severe case of preeclampsia and not know what that meant. And we spent about a month in the NICU, and it was just a very difficult time. And so going through those simultaneously, um, it was some really dark moments. But, at the same time, I did see change, come from that ordeal with Nike. I'm really happy, even though it was hard, that I did speak out and that colleagues and friends of mine spoke out as well, and that today they do offer 18 months of maternal protection for their athletes. But that took a big fight, and it came at a cost. And so that was really hard. And, going through that experience with my daughter and giving birth to her in such a traumatic setting, it just opened my eyes and gave me a really big heart for maternal health, and made me want to do more. So I'm grateful to now be involved in that space and do my best to advocate for other women, families, and mothers, in general. I think one of the big reasons that we wanted to chat today was to talk about Goldbug's new project for pregnant and new moms, Healthy Beginnings. So, Katherine, can you give us just an overview of what that program really is and what you're hoping to achieve with it?
Sure. I started this journey, or we started at GoldBug this journey supporting doulas actually at Denver Health Hospital here, supporting women that were underprivileged, and giving doulas stipends in order to create a sort of more robust doula pool that was representative of the mothers that they were serving. And that really worked out for us. And in fact, that support did in some way, small way maybe, but some way helped inform policy here in Colorado, where we now support doulas with funding. So that was sort of a model then that we used to step into a guaranteed income program where we are piloting giving money to 20 mothers. 10 are in the rural community and 10 are here in Denver, and selecting mothers in their third trimester to give them an outlay of cash on a monthly or biweekly, I guess, basis for 15 months. And we're at the very beginning stages of this project. It's started at the end of November, and we're looking forward to using that model to then hopefully, inform policy later. And that's what we're hoping to achieve, is scale it, right? So, we've got some kind of budget to be able to do this, and really fortunate with the money that we do have and being able to allocate it towards this cause. But we know, like, to really scale it, we're going to need some federal funding or lots of additional sources. So, Allyson, as a mother yourself, I mean, how do you navigate the complexities of maternal health and wellness? And what support systems or resources do you believe are essential for new moms, especially those from marginalized communities?
Yeah, I think, for me, it's been a lot of just understanding risks, complications, all of those things. I think going through this for the second time, I feel like I've been in a much better place. But I think about all of the new moms or first time, mothers, and that they may not know of those things. And I think it's really important to continue to raise awareness, for them to know what to look for, if they might be at risk of having complications, knowing the resources that are available, like you just mentioned with doulas. That's a great resource that women can really depend on, and can help. And so being able to understand how to advocate for yourself in the doctor's office, and what does your support system look like. And so all of those things are really crucial and important, and they've all really been incredible for me. This second time around, I've been really happy with my provider. I've been so grateful to have a doula. And so I'm really leaning on that support system and knowing that I'm not in this alone.
So important. That's so important, right? You wrote in Time magazine after the death of your friend and fellow Olympian Tori Bowie that the important step we must take to protect Black mothers and babies is to enact federal legislation. During the pandemic, we had the expanded child tax credit, which led to a record drop in child poverty by giving monthly funds to every parent in America. The impact on Black children was especially profound because they're overrepresented in children living in poverty, and we know from extensive research that poverty is also linked to many detrimental health effects. Can you speak to why you think programs like this that have such a proven positive effect don't get renewed, or what it would take for us as a country to get to a place where they're the status quo?
Yeah, I think it's really unfortunate that it takes so much work to get some of these things passed. We know how important it is in maternal health in general. We've seen it with the Momnibus Act, and that some of these things that they seem like no-brainers are difficult to get moved forward. I think the biggest thing is that it is not going to be solved just by one person, one organization, one entity. We really have to come together, and it's going to be collaborative, and we have to get out to get these things passed. We, even in the face of like all of this research and all of these proven outcomes, it can still be challenging and difficult. And so I think it's really about continuing to raise awareness and let people know that there is legislation, there are policy changes that can be helpful, that we want and need to get moved forward. I know, Katherine, you mentioned one of the hopes of the Healthy Beginnings Project is to present a solution to policymakers, to close that racial and economic gap in maternal health outcomes. And what are you seeing in terms of who is receiving the money and how being a part of the program has affected their outlook on pregnancy?
Yeah. Well, as I mentioned, we are still in the early stages in this pilot. Within our own group of 20 women, 15 women identify as a person of color, and 17 of the women fell below the national average on the consumer financial well-being scale. They are having a hard time making ends meet, paying debt, covering day-to-day needs, getting, their diapers and preparation for everything taken care of, including their own health. The women have expressed great hopes for their pregnancy and want to provide the best for their babies and families, of course, like everyone. This money helps to alleviate stress to them by helping to reduce debt, for instance, pay for health care, food, and experiences. So I'm so thrilled that, together we're able to do this collaboration, which will be available in early May on the GoldBug website and on Amazon. Can you talk about what inspired you, maybe after I tackled you, to collaborate on this collection, and also speak to why you selected March of Dimes to receive a charitable donation as part of this collaboration?
Well, after we met and talked, I was really excited about the possibilities. I thought a lot about what it was like to go back to work and to competition and have my daughter along. And a lot of the things that, I thought about was just traveling with her. And I had a lot of anxiety about that and, what it would be like to take a baby on a plane across the world and in all these different hotels. And it was just a lot. Not only did I know that I needed to focus on the work and, everything that I needed to do to perform at my highest, I also knew that I needed to be present and take care of this little baby as well. And so I think that's really what inspired the collaboration was, how could we come together to give moms and families products that could help them and take some of that stress down, take some of that anxiety down, and make things a bit easier for them. And I selected March of Dimes because after my experience giving birth to my daughter, I knew that I wanted to get involved. I didn't know what that meant. I didn't even know where to begin or where to turn. But March of Dimes was the first organization that was suggested to me. And I remember, taking a deep dive into the work that they've done and understanding that they have a long trusted history in this space. And they have done so much incredible work and research for mothers, babies, and families. And so I know that these funds will continue to further that work and that families will benefit from that. Katherine, can you talk about what roles you see companies playing in driving positive change and advocating for greater investments in maternal health and also just the well-being on a broader scale?
Yeah, this is one of my favorite topics, actually. I believe really that companies have some kind of I wouldn't say obligation is too strong a word, but they have an opportunity, especially private companies. They're in really a strong position to make a difference. The private sector can move faster. I mean, just to your point, it just takes so long to get things done. It's going to take more than just one element of the community to make this all work together. We really have to form an alliance here, and because the private sector can really move much faster with their decision making, we have an opportunity to change quickly. So businesses that can afford more quickly and be more entrepreneurial, I think, is really a call to action on something that I want to sort of take up about, whatever sort of that spirit is to drive change in this issue area. So what, it's a long journey, and I'm looking forward to taking that step forward more broadly. But
Yeah.
what message or call to action would you like to share with people watching regarding the urgency of supporting Black maternal health and fostering equity and inclusivity in maternal and infant care?
Yeah, I think we have to continue having these conversations. We really need to raise awareness. I think back to when I found out that I was pregnant and when I found out I had preeclampsia, it wasn't something that I had talked about with my friends or my family. And so I think we need to make it a more normal, excuse me, we need to make it a more I think we need to make it a more normal conversation around maternal health. Lost you there. Okay. I think we need to make it a more normal conversation around maternal health and talking about risk, complications, how we can push policy forward, how we can make sure that medical providers are receiving implicit bias training. There are so many things that are going to take all of us moving forward ahead. So I think that's my biggest message is continuing talking about it because that's the only way that we're going to continue to improve.
Yeah, I agree. Well, thank you so much for this conversation and for your dedication to maternal health. Really terrific and excited that together we're going to make an impact on maternal health. Thanks, Allyson.
Thank you for all you do. And I'm so excited about our collaboration.